Hi there, welcome back to the Lifestyle Show with me, Pam Joseph. Right, I just say look, we're serious, but it's something that we've dealt with before. We are talking back again about the vaccination and why we have got so many resident people that won't take it. Pam, keep up the good work, says Leroy. Thank you, Leroy. We need to look into this even more. We need to look into it every single time that we can. A vaccination hesitation. This is what's going on in our community. We've got so many folk that can certainly tell us that they have their own reasons why they don't want to take it. They believe that there's something to do with the past, or there's not enough information, whatever. Anyway, here to join us, we have Dawn Butler, Labour MP, Brent. We have Yvonne Coghill, CBE, distinguished nurse, over 40 years experience. And we also have our what we call our viewer guest, Joycelyn Phillips, that we should be joining us now. What we wanted to do, thank you ever so much, Dawn, Yvonne, thank you for joining us. Thank you. I know it's probably bugging you, Dawn, that we keep asking you to do. You've done it, you've helped us out before, and you keep doing it. We've seen you doing your little bit asking people to just come on, stop it, and take the vaccination. But it is an ongoing thing, Dawn, and we need to still keep talking about it. Yvonne, you must know as well, within the community, there's an issue there. Yeah. So we still need to talk about this. So may I ask, I will say Dawn first, because Dawn, me and you are like that. We have to talk, Dawn. You're in my community too. I'm Brent, you're Brent. What's going on?
I mean, you're right, Pam. We do have to keep talking about it because it's real. Coronavirus is a real virus. Some people still believe it isn't. Some people think it's a plandemic and the government has planned all of this. This government's definitely not smart enough to plan all of this. It is a pandemic, and this vaccine, and so there's two things. There's anti-vaxxers, which are in the main not really the majority of people, not really the majority, especially Black people, are not anti-vaxxers. They're not anti-getting vaccinations, but they are hesitant in getting the coronavirus vaccine. And there's loads of different things, and I'm sure you'll ask me some of the questions about why was it produced so quickly? How can they produce it so quickly? And I think that's a genuine question to be asked. How comes it was manufactured so quickly? And that's because, the coronavirus is not a new virus. SARS and MERS were coronaviruses. So it's built on that technology is why it was developed so quickly. And everybody basically took all of the barriers out of the process, and it went a lot smoother. But, there's also a historic context where Black people have been experimented on in the past. And so I completely understand people, being skeptical about it. People saying, well, I don't want to be at the front of the queue. Well, the thing is, we're no longer at the front of the queue. We're at the back of the queue, really far back. And, I really don't want to lose any more people in Brent. We were losing... at one stage, we had 12 people a day dying. That went down to 4 people a day dying in Brent. That's a lot. A lot of people dying.
That's a lot. Brent was bad. We were hit bad.
Yeah, very bad.
Yeah.
And it's systemic, right? So the virus doesn't affect people differently because of the color of our skin. So, the virus isn't saying, oh, look, there's a Black person, let me go and attack them more. But it's systemic in terms of poor housing, poor health outcomes. We know the areas that have, a lower rate of wealth have poor health outcomes. We know that. And so this has just magnified all of that. And we have to understand that and say, look, we're going to save ourselves because the vaccine saves us. It saves you as an individual. It's your individual choice. And the vaccine protects and saves you. It's right that it doesn't stop you from not catching coronavirus, but it does mean, they're still investigating that, but it does mean if you catch it, it won't be extreme, so you're less likely to die from it.
Having the vaccine, and also, Dawn, to add to that, it's about the jobs that many of our community have bus drivers
Absolutely.
and front line.
Absolutely.
Yeah. And as I say nurses, I'm going to bring in Yvonne. I have to bring you in now. Right in the front line.
And absolutely everything that Dawn has said, I would totally agree with and reiterate. The fact is that, you know, people from Black, Asian and minority ethnic backgrounds are at the front line. And as a nurse myself, and I've been a nurse for 43 years of my life, I know exactly what it's like to be at the front line. And we have 21% of our workforce in the NHS are from Black, Asian and minority ethnic backgrounds. An interesting thing that you were saying about Brent, and I actually am a Harrow girl myself, so I'm quite close to the two of you, is that we have thousands of nurses and healthcare workers and social care people from Black, Asian and minority ethnic backgrounds. So they are on the front line. And we knew from the first pandemic that we were being disproportionately affected. We have had hundreds of our staff die in the NHS, not 200, not 300, nearly 900, I've been told. Those figures have not been verified, so I can't say that they're absolute, but I've been told that that's what we've had. And many of them are from Black, Asian and minority ethnic backgrounds. And that is because we're on the front line. That is because we do live in houses with, you know, poor housing. That is because we are more likely or even less likely to be able to get the healthcare that we need and we want. We know that if you are a Black woman, for example, you're more likely to lose your times, 5 times more likely. If you're an Asian woman, 2 times more likely to lose your life. We know that you're more likely to be have all the illnesses, diabetes, coronary heart disease, and so on, more so than your white counterparts. Now, the interesting thing, and this is the thing that hasn't been spoken about very much, but we are going to have some evidence to show this, and they have evidence in America to show this already, that discrimination affects people physiologically, not just psychologically, physiologically. It weakens your immune system and therefore you're more susceptible to illnesses and disease. And COVID is no different to that. And it hasn't been, you know, people aren't singing this from the rooftops, but the fact is that Black and Asian people and other ethnic minorities are more likely to pick up all sorts of illnesses as well as COVID and actually succumb to those illnesses, which is why the vaccine is so important, not just for our nursing and medical workforce, but for actually our communities and everybody in our communities as well.
It is important. The lady that was meant to come on, Joycelyn says such technical problems. Joycelyn has got diabetes and she suffers from asthma. Joycelyn wanted to ask you, Yvonne, I've got those two double whammy, and yet I don't trust the NHS, and yet I've got whammy of this. Talk to me, talk to her. What?
Do you know what, Jocelyn? Please think about this very, very carefully, because you have got what they call comorbidities. So you have the diabetes, you have the high blood pressure. That means that you're even more susceptible to COVID having a terrible outcome than, say, somebody who is from a Black background who hasn't had those comorbidities. If on top of that, you're somebody who is a little bit with a little bit more weight, like my good self, and somebody who, you know, is older, then you're even more likely to actually succumb to the virus. So what I would say to you, they have checked and they have tested people with asthma, people with diabetes, people with heart disease, and they are saying to people the vaccine is safe for you. Now, as we go through this period where more and more people are taking the vaccine, so we've got nearly 20 million people who have taken the vaccine now, and we can see that people who took the vaccine back in the beginning of January, I took the vaccine myself at the beginning of January, and I'm still here. I'm going to be taking the vaccine again in about 3 weeks' time. So I would say to people who have got any kind of illnesses, do ask the questions, do talk to people, but actually really consider taking the vaccine, honestly.
I've been working with the NHS for 20 years. Everything this lady is saying, which is Yvonne herself, is true. It is correct. And we know that because, of course, it's correct. And I love Dawn for what she's doing as well. Being the position you are in, you've got that platform. to talk to people. And I know you're good, Dawn, and you obviously come over very well, and you're calm and everything else. We I don't know, you, me, Yvonne, we need to show it. Yvonne just said she's taken her first one. We're not due till probably April. I think we're April, May, Dawn.
Yeah.
Talk to me.
I'm going to get mine this week. Yeah, I know. And I will take it, you know. And I tell you what, though, the interesting thing, because I've done so many sort of online seminars, you know, people, and you hear all of the rumors, you know, they come thick and fast, right? Yeah. And some realities mixed with, you know, a skewed reality. And you do feel a little bit concerned. You think, oh my, so even I was like, yeah, of course I'm going to take the vaccine. But, you know, it really does affect people. And I think we need to stop as much as we can all of these people who, some people are just doing it for fun, you know, and it's really quite damaging because psychologically it's damaging. You know, we're all on lockdown. People, you know, are struggling as it is sometimes to get through the day. If all you're filled with conspiracy theories, it's going to affect your everyday life and what you do. And so I think we really need to be quite careful about that. Some people think they're really clever. They come out with these things and you think, but that's not true. But, you know, they think they're really clever.
There we go. You got Christine is saying, I've got hypertension, thyroid problems, arthritis, more or less forced to take the vaccine as I have to go into work. Throughout, I have to go into work. She has to take the vaccine. There's Lisa who's emailed in to say, I work with older people. I'm a care worker. I don't want to take the vaccine, but I might be forced to do it. What should I do?
You know what? Nobody's going to be forced to take the vaccine. So it is not mandatory. So people are going to be offered the vaccine. And, you know, what I've just heard about those two ladies who are working on the front line, for their safety, for their personal safety, they really need to go and do the homework around the vaccine. Ask as many people that you trust as you possibly can. I think that's the key thing. Sit down and talk, read, listen, and then make an informed decision and choice. Because if you're actually in those kinds of environments, you're more likely to pick up the virus than me sitting in my house and working on my laptop every day, just myself and my husband. So if you are in those kind of environments and you have those comorbidities, then really think hard about not taking the vaccine. Keep yourself safe.
Yeah. That's going around where people are actually weighing up between the Oxford, AstraZeneca and the Pfizer from America. And people are weighing up, well, hold on a minute. We've been hearing that the Oxford one isn't that good. And it's the Pfizer. But yeah, the NHS is rolling out the AstraZeneca. What can we say about that to them?
Yeah, you know what? I've been in the midst of all of this, and there are 3 vaccines that people are talking about at the moment: Pfizer, Moderna, and the one that you've just talked about, the AstraZeneca one. And actually, they're all much of a muchness, to be fair. The Pfizer one sort of was the one that started off at the very, very beginning. That was the one that got sanctioned, as it were, to begin with. That was the one that came online first. And that was the one that you had to keep on ice and to make sure that it was in the fridge and all the rest of it. Whereas the AstraZeneca one, the Oxford one, as they call it, which has been developed here in this country, much more easy to share around and put around the country and so on and so forth. And they're much of muchness. And I asked a virologist about this recently. I said, can you actually intermix these vaccines? Can you have one Pfizer, one AstraZeneca? And he said, absolutely, yes, you can, because they more or less do the same thing, because those are the kinds of questions that people are asking. So in terms of efficacy and protection, these vaccines do more or less the same thing. So, you know, people worry about, well, I want to take this one or I'd rather take that one. Really and truly, the good news is that both of the vaccines that we have here are actually doing a really, really good job. And we can see that because of the people that have taken it already. We haven't heard any real horror stories. I mean, there are people who get sore arms and might get a headache and maybe feel a bit sick, have a bit of temperature, but we haven't had any real horror stories as yet. So,
but we got Corinne from Richardson. She says, I've got an allergic reaction to eggs, and I was told that I shouldn't be taking it.
No. No. Well, I've spoken to the virologist, and there is no eggs in it in the vaccines. It hasn't been made with eggs or egg yolk or albumin or anything like that. There's no alcohol in it, so that's for other things. There's no meat products in it either. So from that perspective, if people are worried, please, just ask a doctor, ask somebody you trust, ask your imam, ask your pastor, ask people who know what the issues are. And we have so much information out there for people now that they can actually learn and hear about what works and what will not work for them. But what won't work is them just hoping and praying that they don't get COVID. That's the bit, they need to be proactive about this.
Indeed. And Dawn, I think we've got to look at the wider decision. Christine Hope says, I took the decision to take the vaccine because of having to go into the office as I manage staff. I say, forced as I know, I could have offered a laptop and work from home. Okay. But we had no options. She didn't have an option, and she regards it as she had to take the vaccine, whatever. Sooner enough, it's going to go into the work. I think government may make it. They're talking about a passport, even to travel, Dawn. Yeah. So
that already happens when you travel to some countries anyway. You have to take the vaccine, or you have to take and so that already that's already something that's already there in the system. I mean, the thing is that if you're working on the front line, not only are you more at risk, you're more at risk of having a heavier viral load, because you can get different coronaviruses because it mutates. So if you get 1, 2, 3, then you can mutate that virus. And right at the very beginning, the doctor said to me, this is a really nasty virus. So if you've got something wrong with your heart, it will attack your heart. If it's your kidneys, it will attack your kidneys. If your lungs, it will attack your lungs. It seeks out the weakness in your body. And it's a very wicked and nasty virus. And that's why the best thing we can do is to stop people from having systematic, coronavirus and end up in hospital.
And that spread around. Thank you. We have to say 2 of our production team have taken the virus. We've got the producer that's taken it, and we've got our tech lady that's taken it. Thumbs up to them all. I'll take mine when mine's coming. Don't worry about it. You're going to protect Brent, haven't I? You and I.
It will happen soon. Brent's doing an amazing job. The rollout's going really, really quick. So you'll probably get a text this week.
Yeah, we're going to do it. And we're going to do it. Thumbs up for Brent. Thumbs up for everybody. We need. We just seriously need everybody on this, and we need everybody to be positive about this, because there's nothing else. You want to go back to normality? How are you going to do it?
Yeah.
Right. It's like, Go on. Yeah, absolutely. That's what we have.
Yeah, you've got to protect yourself. The vaccination is about protecting yourself. You're protecting yourself by taking the vaccine. Nobody else. If you choose not to, you're saying, I'm not going to protect myself, which is fine. That is fair enough if that's what you choose to do. But, you're choosing not to protect yourself.
Right. And others. Because, if you get it and then you're not vaccinated, it could potentially harm others and family members. It's really important that people think through why they're not taking it.
Yeah.
Thank you.
We've got to help our older generation as well. So, lots of the younger people who are then saying to their parents, don't take it, don't take it, don't take it. Listen, when you've got a family member that dies and you can't go to the funeral, that is no joke.
So, unimaginable. That's the worst thing. We don't want that. Dawn, thank you ever so much. Dawn, Labour MP, Brent, thank you ever so much. Yvonne Coghill, CBE. You are doing a great thing. Race and Health Observatory. You're the head of that. I need you.
No, I'm not the head of it. I'm a race advisor there. I'm not the head of it.
Yvonne, before you
be the head of it.
Swing details so that I can do it at the end to let them know what else you're involved with, because you're involved in a lot of things here that I can see there. And we couldn't even get into that. We will have you more. And Dawn, I'll always have you. And we're going to run it here.
It's a pleasure. Keep up the good work, Pam.
Yes, take care. God bless. Take care.
Take
care. Bye. See you soon. Bye. Take care.
Okay. Next break. Let's go.